faculty, esteemed guests, and our proud families, and perhaps most importantly, my fellow inductees. It is such an honor to speak before you on this momentous occasion where we have been ushered into the medical profession and have pledged to care ethically for our patients. But before we fully step into what lies ahead, I would like to take up a mammoth task of looking back just for a moment at the road that brought us here, because it has been a long one. Most of our youth has been poured into becoming members of this profession, and for many of our families, this journey has meant immense financial sacrifice, and that cannot go unnoticed. I can remember my first day of medical school like it was yesterday. For many of us, it was a dream come true. We were abruptly awakened, though, to the reality of what we had signed up for. Those initial preclinical years were mentally brutal. They tested our stamina, our memory, and whether we could survive on minimal sleep and maximum cortisol. Then we stepped into our clinical years. During our first few weeks at the hospital, we held onto our clipboards like they were life rafts, not sure when to stand or when to speak. And every "whose patient is this?" felt like a personal attack. But slowly, we changed. The clipboard that once protected us was forgotten somewhere in the ward, and we gained confidence and stepped into the action. We dove into ward rounds that elevated our blood pressure more than the patients, anticipating every possible question. We stood in theater for hours, developing what I'm convinced are organs of steel from sheer endurance, trying to avoid contaminating the sterile field, but while secretly praying for a perfect moment to assist in an emergency C-section or to hammer away with the orthopedic surgeons. We mastered the art of strategically laughing at consultants and registrars' jokes, not because the joke was funny, but to reduce the tension before answering a question we absolutely did not know the answer to. Early mornings in emergency medicine, arriving before sunrise, only for the real action to politely wait until the afternoon or long after we had knocked off. And in dermatology, Transfumaran in Chronic 6 became such a song that I am certain no keloid formed against any of our patients will prosper. They may have been demanding years, but those clinical years shaped our character. From each consultant, we learned nuggets no textbook could ever replace. Not just how to treat illness, but how to treat people. We learned how to dress properly for work from some of the rather stylish consultants, and the uncompromising importance of punctuality, and most importantly, hierarchy. We learned to celebrate joy in one room and process loss in the next, sometimes on the same ward. We have seen humanity at its most fragile and its most resilient, and that has changed us forever. These past 6 years were hard years of exhaustion, years filled with doubt, years where sometimes the correction felt personal and the admin battles felt endless. We started as a class of 85, but only 17 of us are here today. Many times, quitting felt easier, especially in the beginning. I even considered becoming a full-time social media manager. But we stayed, we pushed, we endured. The journey we walked together permanently connects us. You are all stitched into my story. We may never stand together like this again. Life will scatter us to different hospitals, different cities, and for many of us, different countries. So today, let's enjoy this moment. Take pictures, smile widely.
With me, right? No.
Let us smile widely, because very soon we will be awakened again from this dream. This time by 3 a.m. calls, by responsibility, by charts waiting to be written, by the quiet realization that someone's life may depend on your decision. But I have full confidence in all of us. We have been equipped with knowledge, with skill, with resilience. We did not just survive medical school, we were refined by it. We are no longer the timid students we were on our first day on the ward. We stand here confident, competent, ready to take on patient care. At the end of our surgery exam, as we submitted our paper, Dr. Besa, our consultant, asked us if what we had written would qualify us to become his colleagues. And today the answer is a clear-cut Class of 2026, we walked through fire together and we came out doctors. Congratulations.